medicines can be small poisons, remember? Whereas they can cure diseases, they can also be taken wrongly and they become poisons. So disease from self-prescriptions, self-medications, or even sharing medicines. The symptoms for the body can look the same, but if you take medicines because so-and-so took them, they are feeling exactly the same way, the diseases may be different.
It is recommended to get a health checkup and to take medicine that has been prescribed by a healthcare professional according to the diagnosis made before taking any type of medicine.
Take that medicine according to the prescription from your trained, professional, licensed health worker.
Better healthcare for a better tomorrow. That was the Health Minute.
UNICAF and Bethany Group are hosting a virtual webinar on the basics of infertility on March 15th, 2024 from 11 a.m. to 1 p.m. on Zoom. Earn a generous UNICAF scholarship to pursue a British bachelor's or master's degree online from one of their prestigious UK partner universities, the University of East London, Liverpool John Moores University, and the University of Suffolk. Register now and achieve your academic dreams. For more information, please send an email to info@uganda.unicaf.org or contact us on WhatsApp at 771 976 750.
Bethany TV for health.
Welcome back, boy or girl. That is what we are talking about here during our discussion with Doctor. It's still Medical Mind. Welcome back from that brief break. Doctor, we were still explaining to us the fertilization process and gender selection in IVF. But someone here told me, Teacher Zeta, kindly ask Doctor this question before you proceed. Yes, is there any food that a man can eat to support the Y chromosome? To boost the Y chromosomes.
Okay.
Especially if they're getting on a girls, to give them energy to push faster and run the race quickly.
Yeah, so unfortunately we don't have evidence to that, and that there is a particular food or medication you can take which can help you to get a particular gender. We still don't have any food that can help you with that. But there are ways in which, like what we said, part of IVF is possible. You can do the gender selection, but also there are some newer ways now which are coming up, which I think if they become available, they will be able to help. Now, in IVF, we select the gender. We do the test after fertilization. That means you have to go through the whole process of IVF. Yes, but there are newer methods. We call them cytometry. Now, this is where we do the sorting of the cells. Here we do cell sorting before fertilization. So this will help to reduce, because genetic tests are very expensive. Genetic tests are very expensive, and they make sex selection process expensive. So now these newer methods are using the ability to separate the X and Y chromosome sperms, and then you can either use insemination or some simpler method of treatment.
Okay.
Yeah.
So is
it experimental?
Okay, thank you. So this process is always 100% sure that whatever that you've chosen will be that.
Yes. So for this one of determining, assessing after IVF process, yeah, this one is a. You can, the error margin is very low, is negligible. It's like 99.9%. Yes.
Okay.
Yeah, because following the Human Genome Project, now we have very robust ways of testing genes.
Thank you. Same way your question is here, we are going to give Doctor the question shortly when that time comes. We are still going to look at the weight, Doctor, the weight of the man.
The weight of the man.
How does it affect
the gender?
The genital, yes, or of the child.
Yes. So the weight of the man,
especially the ones who are overweight.
Yes, we do not have a specific scientific explanation for that, but it's an observation we've seen. But it's possible also it could be related to, it could also be related to their general health, and that may be affecting the survival of the sperms and the embryos as well. But we don't have any specific explanation for that. Yes, we don't have. Because what the weight also does affect is their sexual behavior as well. Whether that translates into this discrepancy in the gender, we don't know.
Okay.
Unfortunately.
Okay.
Yes.
Thank you so much, Doctor. It's still Medical Minds. We are talking about gender or sex selection. Why boy, why girl? And if you've been keenly following what Doctor is explaining to us, you're free now to keep sending in your messages on those numbers that will always keep running on the on the screen, and Doctor will answer you back. Asema is saying, please, Doctor, teachers, kindly ask Doctor this: how do I know that I'm ovulating?
Okay.
She wants to time. I think she's planning to time.
Now.
Yes.
Oh,
yes.
yeah. Okay. So she wants to use the knowledge of meeting after ovulation.
Exactly.
Yes, yes. So ovulation is, there are certain things you can notice as a woman to notice that you are ovulating. The ovulating time, ovulation time. From the symptoms, one is you can feel the ovulation pain. There's a specific pain which you feel on one side. It's either on the left or on the right. It's not in the middle usually. So that's sharp pain. And it is a pain of release of the egg. That's one of the things. But also the change in the mucus. If you have been noticing how your mucus is behaving, the cervical mucus, the discharge, you can keep on assessing in your finger and see how far it stretches. So the mucus at the time of ovulation usually stretches longer. What we call a Billings test. So it stretches longer. So that is the time. And another thing is you can actually notice your sexual drive going up at the time of ovulation.
The urge becomes higher?
The urge, yes, the sexual urge, the desire for your husband goes up. The likes and so goes up. But also if you can measure your temperature early in the morning. If you find there's a rise in the temperature and it remains consistent for some days. So those are the ways. But also you can test. There are ovulation test kits available now. Yes, they are there.
How are they, like the SCG tests?
They're like SCG tests.
Okay.
They are sort of, they are strips.
Okay.
You can test in your urine. Early in the morning you test and then you will see 2 lines appearing. It's called OviCheck. OviCheck. Yeah, they are available. Thank
you so much, Doctor.
Yeah.
Those were some of the most important questions that we wanted our viewers to know about sex selection. The rest will come aboard. Last week we didn't answer some of the questions, and we promised that before we dive into answering these other questions for this Sunday, we shall first attend to you. Number one, we had one who, I think, Rachel. Thank you for the show. We really appreciate everything. My question is, when a mother loses a baby immediately after birth and the baby is buried with his or her umbilical cord, can that same mother conceive again and give birth to a healthy baby who would have a healthy life for years?
Yes, okay, that's thanks for that question. The straightforward answer is whether the baby is buried with the umbilical cord or not has no effect on the reproductive life of the mother. Yes.
This was Rachel.
It's more of a myth and a cultural practice. So once the umbilical cord is out with the placenta, it has nothing to do with the mother's health.
Thank you so much. I have 2 kids, Doctor. I've never gotten normal labor pains, but whenever it's 41 weeks, my cervix opens up to 2 centimeters. They normally induce me. I would like to know what it could be.
Yes, so she's wondering why her labor does not set up properly at the time of when she's ready to give birth. Now, the initiation of labor, the process of initiation of labor is a very complex hormone and nerve process. Unfortunately, medicine is filled with gray areas. And gray areas where we know something but not much. And this seems to be one of the areas. We still don't know the exact trigger of labor. And even those where we think it's some hormones from the adrenal glands, maturation from the baby's brain, all those things are speculative. We don't know the exact mechanism. So this process, this issue of one, for example, why should labor start at that stage? We do not know the exact reason. And why it starts in some people and in others it does not start, we don't know. So it remains why labor starts at that time. It remains a mystery.
And of late it's too much, doctor. Many ladies are going into giving birth without labor pain. They are getting induced.
Yes, of course, the ideal thing is when your labor, we estimate the time period, the normal time period where the pregnancy should be, up to 40 weeks. But there has to be some allowance usually. You have to give an allowance of about 2 weeks if there's no problem at all. Because sometimes these estimates are wrong. There can be some errors in the
True.
dates.
It could be that really. Yeah.
So it's not a good idea to rush.
Sometimes the scan tells you 40 weeks, yet you're still 30 something.
Exactly. So when you are deciding to give birth, sometimes if you just wait for the 2 weeks, of course this will be discussed with the health worker. They have to rule out any other problem. The babies will be okay, the mothers will be okay, the water around the babies will be enough. No impending problem. You can give 2 more weeks.
Thank you so much.
Weeks.
I think you have someone who wants to talk to you, Doctor. Bethan TV, good evening. Hello, caller. Hello. Sorry, I think the network is not very okay. Thank you, Doctor, for that. That was, I think, Stella from Chinawataka. I get periods twice or 3 times a month. Sometimes I miss for 2 to 3 months. I'm 25 years old. My name is Stella from Mulago. This was one of the viewers last week.
One of the questions from the viewers, yes. So there are 2 things there. First of all, she's having irregular periods. She says that when the periods come, they happen twice a month.
Or 3 times.
Or 3 times. And then there comes a time when she misses her periods.
True.
Usually, it's not mixed up like that. But if you are missing your periods, as we always say, a period is an interplay between hormones and the womb. If she's missing her periods, the most commonest cause in a young girl is in somebody like that usually is those things called PCOS. That's one of the commonest causes. But if the period comes more frequently, that could be something else. But it's also PCOS can be the cause.
Okay.
So she needs an evaluation of her hormones and possibly a scan to look at the womb and the ovaries.
Thank you, Doctor.
Yes.
This is Cara from Seta. Please kindly help me, Doctor. I always have false pregnancy. She can test. She gets all the symptoms, but only to discover after a month that it was a false alarm. What could that be?
She tests and then it is positive.
Yes, she feels like she's saying she normally feels like the nausea. She feels all the symptoms.